Start, Doctor.
Hello, good afternoon. I'm Dr. Sharma, one of the doctors in the clinic today. You must be Mrs. Patricia, 30 years old. Am I correct?
Yes, Doctor.
Well, Mrs. Patricia, I'm here to talk to you regarding your health issues. Is that all right with you?
Yes, Doctor. Nice to meet you.
Okay, nice to meet you too. So, be present during our conversation.
It's sound not clear now. Not clear. What again?
Would you want anyone to be present during our conversation here today?
No, Doctor. Thank you very much.
Okay, so Mrs. Patricia, can you tell me in your own words how far do you know about your condition so far?
Yes, Doctor. Yesterday, I was collapsed in my home in my kitchen. I really don't remember what happened, and I found myself in emergency, and they admit me, and no one tell me what happened. Doctor, please inform me, Doctor, what happened.
I'm really sorry to know about what has happened to you, and I also am aware that you did hurt yourself. How are you feeling now, Mrs. Patricia?
Yes, Doctor, I am better, but I has wound in my head, Doctor, and I have injury in my tongue. I really it's pain only, Doctor, but it's okay, Doctor. Thank you,
I'm really sorry to know about that. I hope it gets well
thank you,
soon.
thank you.
So, yes, Mrs. Patricia, the thing is, as you have known, we are very concerned about what has happened to you. And we did run some tests to find out what exactly could be wrong with you. Do you have any idea or any expectation what that might be?
Yes, doctor. I really maybe this problem. I lost my conscience because I not sleep well 2 days ago. I have my stress in my job and uh, really don't finish a lot of my job and I not have a lot of sleep. Maybe cause this, doctor.
Okay, I appreciate your concern. Well, Mrs. Patricia, we have run tests and our consultant has reviewed your condition very carefully, and we do have a diagnosis behind what has been causing all these to you,
Yes.
and the diagnosis shows that you are suffering from a condition called epilepsy.
Oh, doctor. Yes, epilepsy. Yes. Because my cousin has this problem, doctor, and he suffered now. Is this difficult case, doctor, or simple case, doctor?
I appreciate your concern, Mrs. Patricia. Do you have any idea about what epilepsy is, or would you want me to explain this to you? It can be simple to difficult, but we have our management plans, and definitely we'll be discussing that with you as well.
Okay, doctor, please. I want to
Would
know.
you want me to explain what exactly epilepsy is?
Yes, please, doctor. I want it. Yes, doctor.
So as I'm drawing over here, if this is our brain works through different channels or different electrical activities that runs in our brain through, nerves or electrical channels that we call. Sometimes what happens, these get disturbed, and when it gets disturbed, we have this some kind of shakiness in our body. Sometimes we lose our consciousness. As a result, sometimes we may hurt ourselves, like in your case you have hurt your tongue and also your head. So yes, this abnormal the signaling in our brain can result a condition that is called epilepsy. Are you following me, Mrs.
Yes,
Patricia?
doctor. Yes, yes. I follow you, doctor. Thank you. I follow you.
Okay, so uh, have you got me what epilepsy can mean?
Inform you what I understand from you, doctor.
Yes, so
Yes.
this is the condition called epilepsy,
Yes.
and b- before we proceed, can I also ask something about yourself? You've been telling me you had some stress and you were not able to sleep properly few
Yes.
nights before as well.
Yes.
Okay, so what happens, Mrs. Patricia, if someone is not having proper sleep and also, lots of stresses in the life, this might, aggravate or this might even cause this abnormal shakiness. So
Yes.
we need to follow a proper plan of life, and a proper management the treatment or the management involves this proper planning. So sleep deprivation is can trigger your this shakiness, what we call, or the seizure. So if you need any help from us, like if you're having too much stress, we can involve our mood doctor, and also if you're having too much stress at work, we can involve our occupational health department. They might be able to help you regarding this. Will you be interested in that, Mrs. Patricia?
Okay. Thank you very much, Doctor. Yes, thank you. Thank you for that.
May I know what you do for living?
I am a housewife, but I study in faculty, and these days I have exams, and so I have some stress and not sleep well.
Okay, okay. So definitely we'll be helping you regarding that by referring you to our uh, work departments, regarding social work department and occupational health
It's
department.
okay.
Some more things we need to know about you too, do you have any hobbies like swimming or anything like that in particular?
Have what, doctor?
Any hobbies?
Hobbies. I like swimming, doctor. Swimming.
Okay, so Mrs. Patricia, I'm afraid to tell you that since you're having epilepsy, we need to ask you not to swim unsupervised, because sometimes while swimming, if you have this kind of shakiness, it might be it might danger in your life too. So you need to look after this as well. Uh, and also, Ms. Patricia, would you want me to explain what we have planned for you so far, or what we're going to do? Any concern you have so far to ask me?
Yes, doctor. I want to ask about is treatable, doctor, or not treatable, doctor?
Well, Mrs. Patricia, I appreciate your concern. This epilepsy, I'm afraid to tell you that we cannot uh, completely cure it, but we will be giving you medication. We will have my consultant and our team will be looking after you. We'll be giving you some medication to control your shakiness, and we'll be following you up regularly so that you do not have an attack like this in the future. And we will be giving you the medication in appropriate dose, and hopefully if everything goes well, we can we can control your symptoms. Are you
So,
following me, Mrs. Patricia?
yes, doctor. Yes, thank you very much. So for how long, doctor, I will take this medication, doctor?
Well, it depends on the medical team. They will be assessing you further, and they will start the medication appropriately. And usually it takes it takes time to take the medication, but since we will be involved, our team will be following you up regularly, and you might need to take the medication for quite a long time.
It's okay, doctor. Thank you, doctor. It's okay.
uh, any other concern you have at the moment?
Um, no, doctor. It's okay. As I told you, I recently married, doctor, and I want to have a baby. Is any problem to
Mhm.
have baby with this medication, doctor?
I appreciate your concern, Mrs. Patricia. Well, there are a few kinds of medication that are available for a condition like this, and I will request you to inform the medical team. Especially, we will be having a woman doctor in our team as well. So it will be better to inform before planning a pregnancy, because this medication might cause some problem with your pregnancy and also the baby. So before you plan, it is advisable to inform us, so that we can give you the appropriate medicine and prevent any kind of harm to you and the baby. Will that be all right with you?
Yes, doctor. Thank you very much, doctor. It's okay.
Okay. Can I ask you a few more questions about yourself?
Yes, doctor. No, okay. So now you will refer me to another doctor to give me that medication, as you told me, doctor.
Well, I appreciate your concern, Mrs. Patricia. What we're going to do now, our medical team will be, our consultant will be letting you know what exactly medication will be starting you on. if any medication is needed at all or not. And from there onwards, we'll be following you up regularly. Will that be all right with you?
Thank you very much. So, doctor, can you give me some advices about to avoid these attacks to come again, doctor?
Sorry, I did not get you.
Are any advices to avoid this attack again, doctor?
Yes, I'm coming to the point. Can I ask you a few more questions? Like, do you smoke, Mrs. Patricia?
Sometimes, doctor. Yes,
Can you give me an idea how many sticks for how long you've been smoking?
about 20 cigarettes per day, doctor.
Okay, so Ms. Patricia, I'm not being judgmental, but what happens, smoking might aggravate your condition too, and it is all over harmful for our body. So if you wish, we can refer you to the smoking cessation clinic. They might be able to help you regarding if you plan on quit smoking. Will that be all right with you?
Yes, doctor. Please, again, please.
We'll be referring you to the smoking cessation clinic if you are planning on quit smoking, because it will be
Okay.
helpful for your
Thank
condition.
you.
Will that be all right with you?
It's okay, doctor. Thank you very much.
Do
Two
you
minutes
take
remaining.
alcohol, Mrs.
Two
Patricia?
minutes remaining. Yes, doctor.
Do you
Sometimes,
take?
occasionally, doctor. Yes.
Okay. Well, sometimes alcohol can act as a precipitant, or alcohol can, cause the seizures to be more. So it will be advisable for you to limit that intake of your alcohol as well. And do you drive, Mrs. Patricia?
Yes, doctor. Drive. Yes, I come with my car.
Okay, I'm afraid to tell you that since you have been diagnosed with epilepsy, it is advisable for you to inform the DVLA and not to drive till you get a clearance. I'm really sorry to tell you that. Will that be okay with you?
Yes, doctor. It's okay. I will try to stop driving now. It's okay. Thank you, doctor.
Okay, thank you so much. And so, Mrs. Patricia, can I summarize what we have talked about so far today?
Yes, doctor. You informed me about I have problem in my brain, electricity of my brain. So it's caused my
Mm-hmm,
disease called epilepsy, and this
mm-hmm,
causes one of causes is my stress and my sleep decrease in my sleep. And you advised me we will start medication for this problem, and advised me to avoid driving. And
mm-hmm.
that's what I understand from you, doctor. Thank you very much.
Okay, thank you, Mrs. Patricia. I'll be giving you some leaflets and brochures as well. Over there, you'll be able to understand what in detail about the condition and what exactly you have to avoid. And if you have any queries or questions, you can always contact to our emergency number given to you. And if you need any taxi or anything to go on to your home today, we can also assist you regarding that.
It's
Anything
okay.
else you want to ask me about? Any
No, thank
concerns
you.
you have so far?
Thank you very much, doctor, for your intervention today.
Okay.
Thank you very much. Thank you.
Thank you, Mrs. Patricia.
Excellent, Doctora. Doing well. It's okay, very much. Very good. But yeah, it's okay. You are doing well for presentation and discussion with the patient and the examine. But if it's better to increase um, advices, it's very important. This very important case here is about advices about this housewife. You have to offer some, give
Mm-hmm.
here some advices. But you are excellent about driving. Very, very important, and about the pregnancy. This female also about female, you have to inform about the OCP, very important, or consistent beats, because
Okay.
interaction
Okay.
very, very important.
Okay.
About the pregnancy, it's okay. I told you about the pregnancy, but better start to me sometimes not me ask you about your other pregnancy. You have to think in this
Okay.
medication is a pregnancy and medication with OCP.
Okay,
And
sir.
advice, I will give you a lot of advice now. Is very, very important advice in the case of the epilepsy. It's okay.
Okay, sir.
But in general, excellent, Dr. Shema, very excellent presentation. So any
Thank
one
you.
of my other colleague can help us in this case if you want to add any um,
Sir, I think I should have also mentioned about to not to go into any sharp cutting instrument, to be aware of those. I had to tell her that as well. I forgot
excellent.
to tell
It's
about
okay.
those.
Excellent.
I think she should tell her she swim. Somebody should watching her during these dangerous hobbies.
Yes, she
Another
informed.
thing,
Okay, sir.
She informed me.
yeah,
She informed. She informed. Yes.
Another thing, try to share the family and friends about her condition because they might help her in case she develops these attacks again.
Excellent, excellent, doctor. Excellent, Dr. Ababait. It's okay.
Also to add, she needs to have a badge or any note in her pocket or anywhere just to carry.
Yes, better is. If
Yes.
collapsed or
Yeah.
if collapsed or any has attack, anyone knows this take medication can help here.
Yes.
It's okay. It's
That
okay.
she's a known epileptic.
It's okay.
Okay.
Is anyone has any another comment?
I didn't hear the whole encounter actually, but I think triggers must be discussed as well. Triggers for the seizure, and these should be the alarms for them and must be avoided also.
It's okay. It's okay. So is also this a female and housewife? What about housewife? Yes, Dr. Marwa? Yes. Dr. Marwa has any comment?
Counseling about this.
Yes. She is female and housewife, and this some advice very important in the home to avoid because it's epilepsy.
Yes.
What about
Yes.
fire? What about fire? In surveillance and
Fire and sharp cutting
Yes,
instruments, right?
oven fire very important. About any kitchen, about avoid any any sharp object, maybe a knife or something. Very important. About height, maybe bring anything from height, maybe attack during high. It's okay. And also, if she take pass, please don't close the door from inside with key. Try to close it, but not close with a key, because anyone can survive you if any attacks. It's okay. I think it's very important to just to give hint about it and try to avoid the triggers as one doctor told. Try to avoid stress and avoid the sleep deprivation and avoid watch TV in the what that mean without light. Yani maybe close the light of the room to see the vision. It's very important. This very important inducer for this epilepsy. It's okay. And avoid strong flashes or voices. It's okay. I think this very important about the and driving. طبعا very important driving and pregnancy or consider beads very important. I think this is my advice about this condition. Is anyone has another comment to add it? So okay, so I will start to comment this case. One case of today is I think also this easy case, not difficult case, but it's very important to remember about the lifestyle and advices to give this patient. Safety for the patient is very important. So as Dr. Shema is doing excellent. Start to introduce yourself. I'm Dr. X. It's okay. I wanted to confirm you are Mr. or Mrs. Patricia, 30 years old. Yes, doctor. Nice to meet you. Nice to meet you. Today we'll discuss your condition. It's okay to you? Yes. Do you want anyone to attend our meeting today? No, doctor. It's okay. So how much you know about your condition? Yes, doctor. Yesterday I has collapsed in my home, in my kitchen, and really I don't remember what happened. And I wake up, I find myself in ER, and they doing one scan into my brain and inform me will discuss this issue with you. Please, doctor, inform me what happened. Yes, doctor. What's your expectation? Yes, doctor. I really I have a lot of stress in my job and in my study, and really I don't sleep well. I think this is from tired or fatigue from this exhaustion or from other stress. It's okay, doctor. It's okay, Miss Patricia. Really, we are doing tests and imaging your brain, and our consultant confirms that you have problem called epilepsy. And stop. Oh, doctor, I heard about it before. I read about it. I have problem in my brain. Doctor, please inform me. I'm really sorry about you hear that. I know it's difficult to you, but we can discuss this issue today, and I will give you a lot of information about your condition. So, okay to you? Yes, doctor. So, your condition, epilepsy, is you can draw, or if you want to draw the brain, or don't. If you want, as you want or no. But epilepsy is active focus in our brain, send abnormal impulse or electricity or abnormal electrical impulse in our body. So is active focus in our brain send abnormal electrical impulse and cause abnormality in electricity of the brain. So it can cause shaking your body as it happened with you, and maybe affect your conscious, and maybe cause your bite your tongue, or maybe loss of control of your water work or your bowel habits. The many triggers or many causes of this condition, Mrs. Can induce this condition, as sleep decrease in the sleep, or not sleep well, or stress, or strong voice, or strong flashes light may cause this condition. So you can present with, I am maybe take sometimes give here, you are following me. It's okay to you. I am really sorry about informing you this condition. I know this bad information, but you are here today to help you as much as we can. You are give definition about the disease and presentation symptoms as shaking your body, loss of conscious, maybe bite your tongue, loss of control of your water work or bowel habits. So okay. I will refer you to multidisciplinary team in the form of the brain doctor and occupational worker and health worker to control your condition, and you will give you brain doctor will give you the plan of your management. In the medication is a form of oral tablets, to control best interest for your condition, or to control this attack, or to prevent this attack to happen again, in the form of oral tablets. If she asks you about the duration, and if you're not sure, you can escape this question. You can inform here. The plan of management will be arranged by the brain doctor. Will give you a lot of details about the plan of your management. Plus, okay, if you're not sure about the duration of any disease, and if not sure, can escape this tricks. You can inform here. All the plan of management will be informed by the brain doctor, and he will give you the plan of management, and according to your condition and according to your response, he will adjust your duration and your dose of medication. Very, very important. So you are referred here to multiple team, then give here medication. Can I ask you about something, Mrs. Sarah? You are taking a drug? No, doctor. You are taking any you take oral contraceptive pills by the name? Yes, doctor. Very important. Please, I am. Yes, doctor. This medication may interfere with oral contraceptive pills. So you have to inform your brain doctor. You are take oral OCP because to avoid interference with action of this medication. So if any female, please don't forget the OCP. Another thing very important is the female also. You have to ask about the pregnancy. You have any plan for pregnancy? Very, very important. Yes, doctor. I will be married. I have to problem. Or I will I'm planning for pregnancy in last year or next year. Please, when you decide about the pregnancy, we will refer you to multidisciplinary team in the form of the nerve doctor and obstetrician doctor to give you the proper management or proper plan of management, because also the epilepsy may be increased during pregnancy, and the medication may be changing the dose of medication during the pregnancy, and some medication not allowed or contraindicated or forbidden or not taken during pregnancy. Some medication you have to not taken during pregnancy, maybe hurt your baby. So you have to inform your brain doctor to refer you to obstetrician doctor to arrange the medication, because this medication maybe harm the baby. You can take some medication not harm your baby. So I give you some question, and maybe asked in the exam. So you have to please not forget the pregnancy and not forget OCP. Another thing very very important, not forget the driving. What about your driving? Very very important. Your drive, yes, doctor. Please, please. If you drive, the attack maybe came to you in during driving, so you can harm yourself and harm another people. So please, you have to stop driving and you inform DVLA until you are complete free from this attack under the control of the medication. Please, so stop. You have to stop your driving until inform DVLA and with follow up to inform you when you can start or return to your driving again, because it's harmful to you and other people. So you now take OCP and the pregnancy and the driving. About the lifestyle, very very important. Please to avoid, try to avoid to stress, try to avoid stress and sleep deprivation, and try to avoid the strong voices and strong flashes. Try to not see the not watch the TV in the dark room. So, okay, because this trigger or this causes can increase the attack of the epilepsy. And also please try to take safe to yourself, or try to not hurt yourself. Try to avoid try to when as doctor asking me about the word what's your hobbies, I told her I am swimming. I love swimming. So when you try to swim or try to swim, please swim under observation. This because the technique come to you during swimming. So swimming very important. Please, when you are take your bathroom, please not close the door from inside by the key, because attack, if an attack, can anyone inform or can help you in this attack. And also, as one doctor told, please inform your family and your friends, because you may attack come you, how to manage or how to give you the proper medication during the attack. And also, if you have maybe have any card or any card in your pocket, to inform anyone if you have this attack in anywhere, can anyone can help you or drive you to any hospital. So, okay. And please also, when you are travel or take any antibiotic or travel outside, please not take any medication until you are inform your doctor, because some medication interfere also with the action of is anti-epileptic or anti your medication. Please not stand beside any fire. In the fire very important. Fire in oven very important, and any sharp object. Try to avoid standing with any near sharp object or fire, very important. And high altitude, if in high altitudes, try to avoid to go high, because maybe attack came to you and affect you and drop from the high. So, okay. This all advice very important. So lifestyle very very important, and OCD and pregnancy and medication and driving, I think all this very very important. So what's your job? As I can told you, I am housewife, it's okay. I am driving, I'm driver, it's okay, give him. I am engineering and go to high, very important, give advice about the high, very very important. So high altitude very very important, to avoid to inform the patient about the high altitude. Is anyone helping you at home, support you at home? Yes. While you are smoke, yes, doctor, try to avoid smoking. I will refer you to smoke cessation clinic. And drink, please try to avoid drink. Try to avoid drink, because maybe drink one cause or increase the incidence of the epilepsy. So we can ask you about is curable or not curable. I am really sorry, and it's not curable, but we can control it. We can control attack with medication. With medication, the best interest for your case, with regular follow-up in your medication and regular follow-up with our clinic, we to avoid the attacks again. What about pregnancy? Pregnancy, can you ask about I will be pregnant? Is any problem? Yes, I am really sorry to inform you. During pregnancy, may attack be increased. So when you decide of planning for pregnancy, we have to refer you multidisciplinary team in the form of woman doctor, it's okay, woman doctor or obstetrician doctor with nerve doctor to give you the plan of management, because we need to avoid some medication during pregnancy, and because some medication may be harm your baby. So, make summary. So today we're discussing your case as epilepsy, and we'll refer you to maximum routine, and I give you some advice to avoid any attack again. So, please can inform me what's the message for our discussion today, and you understand from me. Will inform you. Uh, Thank you, doctor, for your discussion. You inform me I have disease called epilepsy, maybe because this abnormal focus in my brain, abnormal abnormality in my electricity, and you will give me some medication to control my condition. Thank you, doctor, for helping me. I will give you some brochures and leaflets and website about the epilepsy. I will can arrange you to anyone to drive you to your home. If you want anything, you can contact me anytime. Anything else you want me, Mrs. Patricia? No, thank you, doctor. I think we are cover every point in this case. I think it's very. It's okay. So anyone has another comment can edit anything. It's okay. Is anything?
Sir, will it be better? Hello.
Yes, doctor.
Will it be better for also tell her that do not take any medication without informing your GP before
Excellent.
taking any medication, because they have interaction too?
Yes, excellent, excellent. I told this antibiotic or someone when travel can take in anti-malaria drug. Anti-malaria drug may be interference with medication. Any drug, يعني not please, if you are taking any medication, please inform your doctor to avoid some medication interfere with the action of anti-epileptic drug. Yes, doctor, very important. Drug very important. Yes. Is anything else you want anyone to add it? It's okay. I hope today you are take two simple cases, hereditary hemorrhagic telangiectasia and epilepsy. I hope it's helpful to you and this nice meeting. Thank you very much. Inshallah, next week, inshallah, I will arrange another meeting with you. Thank you very much. And anytime, contact me with anytime. See you soon, inshallah. Thank you. Thank you. Thank you, Dr. Ziya. Thank you very much. Thank you. See you soon, inshallah.
Thank you.
Thank you, Doctor. Thank you.